Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we are diving deep into a fascinating medical mystery. We've got some really subtle clues, some perplexing symptoms, and the culprit? Well, the culprit is an insider, hiding inside the patient's own body.
Just think about that for a second. What if your body's own defense system, the very thing designed to protect you, turned against you and started attacking your own muscles? That is the exact question we're going to explore, and it's the key to unlocking our patient's entire story. So, our story kicks off with a 60-year-old woman. She comes into a clinic with this really peculiar problem, something that's been getting worse and worse over the last 6 months. Okay, here's the initial case file. She's got these vision problems, and I love her description. She says her eyes are just getting tired. But here's the real kicker. Her symptoms are always worst in the late afternoon and into the evening. You know, this kind of fluctuation, this pattern, is a huge piece of the puzzle. And of course, we also see her smoking history, which is always a red flag for doctors. So during the exam, the doctors find something really specific. The muscles that actually move her eyeballs around, they're weak. But the tiny muscles that control her pupils, they're working perfectly fine. Now, this isn't just some random detail. It is a critical, top-tier clue that helps them start to narrow things down. So let's recap the pattern we have here. We've got eye muscle weakness that gets worse the more you use them, but the pupils are totally normal. For a neurologist, these clues are screaming a classic diagnosis. It is definitely time to unmask our culprit. And the condition is Myasthenia Gravis. The name literally means grave muscle weakness. It's an autoimmune disorder, which confirms what we suspected right from the start. Her own body is attacking that absolutely vital communication link between her nerves and her muscles. But what does that attack actually look like? You know, to really understand what our patient is going through, we have to zoom in, way in, down to the microscopic level where this battle is raging. The absolute best way to picture what's happening is with a simple lock and key analogy. Think about it. For any muscle in your body to move, a nerve has to send it a chemical message. We'll call it a key, to basically unlock the muscle and tell it to contract. Now, in a healthy body, this whole thing is a super smooth 4-step process. A signal zips down the nerve, which then releases a chemical key called acetylcholine. This little key floats across a tiny gap and fits perfectly into a lock, which is really a receptor on the muscle's surface. And when that key turns the lock, bam, the muscle contracts. It's so simple, so elegant, and it happens millions of times a day without us even thinking about it. But in myasthenia gravis, the immune system goes haywire and creates these rogue antibodies. You can just imagine these antibodies as little pieces of gum that are plugging up all the muscle's locks. So when the nerve releases its key, it floats over and it can't find an open lock. The signal fails, the muscle doesn't get the message to contract. And that right there, that's the weakness she feels. Okay, so now that we get the microscopic battle, let's circle back to our patient's case. Because with this new knowledge, every single one of her symptoms starts to make perfect sense. Let's tackle the biggest clue first. Why in the world do her symptoms get so much worse as the day goes on? Why do her eyes feel so tired? This all comes down to a concept called fatigability. So think of it this way. At the start of the day, her nerves have a full tank of keys to send out. Even with a bunch of locks blocked, there are still enough keys to find the open ones. But as she uses her eye muscles all day long, the nerve naturally starts releasing fewer and fewer keys with each signal. So now you have a dwindling supply of keys, and most of the locks are still blocked by that gum. The chance of a successful connection just plummets. The signal fails more and more, and what she feels is this profound weakness, or as she put it, tiredness. Okay, so that explains the fatigue. That makes total sense. But what about that other major clue from the exam? If this whole communication system is failing, why are her pupils totally fine?
Well, it turns out the body uses different kinds of locks for different jobs. The muscles that move our eyes use what are called nicotinic receptors. The muscles that control our pupils, on the other hand, use muscarinic receptors. And these rogue antibodies in myasthenia gravis, they are incredibly specific. They're like little snipers that only go after the nicotinic locks. The muscarinic locks are totally ignored, leaving the pupils completely safe. This is such a classic telltale sign for doctors.
This is all clicking into place. But hang on, there was one more finding in our case file, remember? a mass they found in her chest on a CT scan. So what on earth could a mass in her chest possibly have to do with her tired eyes?
Well, that mass was found in a small gland called the thymus. You can think of the thymus as the immune system's training school, right? It's where immune cells learn to tell the difference between you and foreign invader. But in a lot of patients with myasthenia gravis, this training school is faulty. A thymoma, that's the mass they found, can cause the thymus to mess up and actually train immune cells to attack the body's own muscle receptors. So this faulty gland is ground zero. It's the source of all those rogue antibodies.
Now, you might be thinking, well, other things can cause muscle weakness, right? And you'd be right. So it's super important for doctors to rule out the other suspects. Let's take a quick look at why they were so sure this was myasthenia gravis.
The closest mimic is a condition called Lambert-Eaton syndrome, or LEMS for short, but they are pretty much mirror opposites. In MG, the problem is with the locks on the muscle. In LEMS, the problem is that the nerve has trouble releasing its keys in the first place. This means in MG, weakness gets worse with use, while in LEMS, strength can actually get a bit better with repeated use. And MG is linked to the thymus, while LEMS is often associated with small cell lung cancer. Our patient story, it lines up perfectly with MG and not with LEMS.
So after putting all of this evidence together, the symptoms, the exam, the science, we can actually boil this whole complex medical mystery down into one single, powerful sentence. And here it is. This is basically the formula that solves the case. Fatigable eye muscle weakness plus normal pupils and reflexes plus a thymoma, that equals myasthenia gravis. And the mechanism behind it all? Antibodies attacking the postsynaptic nicotinic acetylcholine receptors, or in our analogy, the gum in the muscle locks.
And that really brings us to our final thought here. This case is just such a powerful reminder of the incredibly delicate balance inside our own bodies. Our immune system is our greatest defender, right? But in autoimmune diseases like myasthenia gravis, that system gets confused, and it really leaves us with a big question. What happens when our greatest defender can no longer tell the difference between friend and foe?